Welcome to the Washbrains Podcast. I'm your host, Dr. Akash Sehgal. Today, we're embarking on a crucial journey into the world of osteoporosis, a condition that silently affects millions of people worldwide, yet remains largely under-discussed. Osteoporosis is often termed the silent disease because it progresses without clear symptoms until a fracture occurs. In fact, it is estimated that 1 in 3 women and 1 in 5 men over the age of 50 will experience an osteoporotic time. This staggering statistic underscores the significance of understanding this condition, not just for those at risk, but for everyone, regardless of their age or gender. So, why should we care about bone health? Well, our bones, they play a fundamental role in our overall well being. They are not merely structural components. They protect our organs, store essential minerals, and enable movement. Healthy bones contribute to a vibrant life, while fragile bones can lead to serious complications, including long term disability, loss of independence, and even increased mortality rates following a fracture. In this episode, our goals are clear: to educate you about the intricacies of osteoporosis, to empower you with knowledge on prevention strategies, and to inspire you to take actionable steps towards maintaining your bone health. We'll explore the biology of bones, the risk factors associated with osteoporosis, and effective prevention and treatment strategies. By the end of our conversation, you'll be equipped with the insights necessary to make informed decisions about your bone health and share this knowledge with your loved ones. Let's dive in. To fully appreciate the significance of bone health, it is essential to understand the intricate structure of bones themselves. Bones are not just some rigid framework, they are dynamic organs with very complex architecture. Let's break down the structure of bones into key components. Bones are primarily composed of two types of tissue: cortical bone and trabecular bone. Cortical bone, which is also known as compact bone, and this dense outer layer forms the majority of the bone's structure. It provides strength, stability, and protection. Cortical bone is organized into structural units called osteons or Haversian systems, which are cylindrical structures containing a central canal surrounded by concentric rings of bone matrix. Trabecular bone, or often referred to as spongy or cancellous bone, is found mainly at the ends of long bones and in the interiors of others, like the vertebrae. It has a porous structure that resembles a honeycomb, providing lightweight support and flexibility. The spaces within trabecular bone are filled with bone marrow where blood cells are produced. Each bone consists of several layers, each playing a very vital role. The first is the periosteum, which is a dense, fibrous membrane that covers the outer surface of bones, except at the joints. It contains blood vessels, nerves, and lymphatic vessels, serving as a conduit for nourishment and sensation. The periosteum is also crucial for bone growth and repair as it houses osteoblasts that aid in forming new bone. Then we have the compact bone, which is just beneath the periosteum. It is responsible for the bone's strength and structural integrity. Now, this layer is thicker in long bones, such as the femur, where it must support more weight. As we move inward, we encounter trabecular bone, which provides structural support and houses bone marrow. This inner layer is essential for maintaining bone density and flexibility. Now, the bone marrow is found in the cavities of many bones. It is classified into two types: red marrow, which produces blood cells, and yellow marrow, which is primarily composed of fat cells. The balance between red and yellow marrow can shift based on the body's needs, especially during times of increased demand for blood cell production. The dynamic nature of bones is facilitated by three primary types of cells: osteoblasts, which are your bone forming cells, responsible for synthesizing the bone matrix. They secrete collagen and other substances to form bone tissue. Osteoblasts play a very crucial role in bone growth and healing. In contrast, we've got the osteoclasts. They are responsible for the resorption of bone. बोन फॉर्मेशन का उल्टा है रिजॉर्प्शन. इमेजिन करो कि एक स्पंज है. वो स्पंज पानी छोड़ भी रहा है और अब्जॉर्ब कर भी रहा है. सो osteoclasts, they break down old or damaged bone tissue, allowing for the remodeling process. This balance between osteoblast and osteoclast activity is essential for maintaining healthy bone density. Now, osteocytes. Once these osteoblasts become trapped within the matrix they create, they differentiate into osteocytes. These cells are the most abundant in bone and act as regulator, maintaining bone tissue and communicating with other bone cells. They respond to mechanical stress and help orchestrate the remodeling process. आप इमेजिन करें कि एक स्पंज है, वो पानी छोड़ भी रहा है और अब्जॉर्ब कर भी रहा है, मगर वो अपनी जगह ऐसे हिल भी रहा है विदाउट एनी एक्सटर्नल मोटिवेशन, लाइक हमको हाथ लगा के नहीं हिलाना, वो अपने आप ही समझ रहा है कि उसको कहाँ जा जाकर बोन बनानी है। ऑस्टियोब्लास्ट गया एक जगह पे, वो एक जगह पे गया, उसने अपनी बोन बनाई अपने आसपास, ठीक है, एंड वो ऑस्टियोसाइट में डिफरेंशिएट कर गया। देन वी हैव गॉट ऑस्टियोक्लास्ट, अगर वहां पे बोन की जरूरत नहीं है तो वो उसको अब्जॉर्ब कर लेगा। This is what happens. This is how the whole remodeling structure comes into place. And this is uh, and अगर इस चीज का imbalance हो जाए in between the whole osteoblast and osteoclast की activity, this is where osteoporosis sets in. Khair, we'll come back to this in a while. The unique mechanical properties of bones arises from their mineral composition. The main minerals include calcium, phosphorus, magnesium, and collagen. Now, calcium is the primary mineral in bone, providing strength and structure. About 99% of the body's calcium is stored in bones. Calcium is the primary mineral that gives bones their strength. The recommended daily intake varies by age and gender, but aiming for around 1000 to 1200 milligrams of calcium daily is a good target to have for most adults. Then we have phosphorus. Phosphorus works in conjunction with calcium to form hydroxyapatite crystals, which gives bones their hardness. जो बेसिक स्ट्रक्चर होता है बोन का, आप कह सकते हैं कि वो हाइड्रोक्सी एपेटाइट क्रिस्टल से बनता होता है, जो उसको उसकी स्ट्रेंथ दे रहा है, उसकी हार्डनेस दे रहा है। उसके बाद आता है मैग्नीशियम। मैग्नीशियम कंट्रीब्यूट्स टू बोन स्ट्रक्चर एंड प्लेज अ रोल इन कैल्शियम मेटाबॉलिज्म। Collagen आता है next. Although not a mineral, but collagen is a very crucial protein that forms the organic matrix of bones, providing flexibility and tensile strength. Your bones are not all hard. They need to be flexible till a certain degree, a certain extent. Here. Now, vitamin D is crucial because it enhances calcium absorption in the gut. Without sufficient vitamin D, even the best dietary sources of calcium won't effectively contribute to bone health. Now, understanding the structure of bones helps illuminate why to maintain bone health is so critical. The balance between the various types of bone tissue, the activity of bone cells, and the mineral composition are all integral to preventing conditions like osteoporosis. Now, let's not forget the importance of bone marrow, which is found within the hollow cavities of bones. Bone marrow is crucial for producing blood cells, including red blood cells, white blood cells, and platelets. It serves as a reservoir for stem cells, which can differentiate into various types of blood cells, underscoring its vital role in our overall health. As we age, our bone density and structure undergo significant changes. Peak bone mass is usually achieved in our late 20s to early 30s, after which we begin to lose bone density. Now, this loss is gradual, but it can accelerate, particularly in women post-menopause due to the drop in the estrogen levels. Men also experience a decline in bone density, although it is very slow and less prominent than women. Understanding these foundational aspects of bone structure and function is essential in recognizing the importance of osteoporosis prevention. By appreciating the biology behind our bones, we can better appreciate the steps we need to take to ensure their health throughout our lives. Now, I believe we have a clear understanding of bone anatomy and function. Let's transition to the next section, where we will explore osteoporosis itself, what it is, and how it develops, and why it is critical to recognize the early signs of osteoporosis. So, let's begin by defining osteoporosis. In simple terms, osteoporosis is a systemic skeletal disorder. वो आपके पूरे skeleton में होता है. It is characterized by low bone mass and microarchitectural deterioration of bone tissue. This leads to bones becoming fragile and more prone to fractures, especially in the hip, spine, and wrist. There are two main categories of osteoporosis. The first, primary osteoporosis, which is the most common type and occurs due to natural aging or hormonal changes. There are two subtypes over here. postmenopausal osteoporosis, which primarily affects women after menopause due to a drop in estrogen levels, which accelerates bone loss. Then we've got senile osteoporosis, which is typically seen in individuals over 70, affecting both men and women due to age related bone density loss. Then we have secondary osteoporosis. This form of osteoporosis results from other medical conditions or the use of medications that interfere with bone health. Conditions like hyperthyroidism, chronic kidney disease, and even prolonged use of corticosteroids can lead to secondary osteoporosis. If you're going to the gym, if you're gonna get those steroids, there is a high chance you will develop osteoporosis later in your life, later in the lifespan. वो तुम्हारी जो हेल्दी लाइफ स्पैन है वो खत्म कर देते हैं. दिस इज अनदर, हाउ डू आई पुट इट, side effect that your gym trainer will not tell you. So make sure you know about all of this before you start injecting yourself with steroids. Now, understanding the type of osteoporosis that one has is crucial for developing an effective treatment plan. For example, secondary osteoporosis may be reversible if the underlying condition is treated or the medication is adjusted. We'll have to talk about statistics a little. See, osteoporosis is a global health issue. According to the International Osteoporosis Foundation, over 200 million people worldwide suffer from this condition. It is estimated that 1 in 3 women and 1 in 5 men over the age of 50 will experience an osteoporotic fracture in their lifetime. The prevalence of osteoporosis differs across regions and demographics. For instance, Caucasian and Asian women, especially those with a smaller frame or lower body weight, are at a higher risk. In the US alone, over 10 million individuals have been diagnosed with osteoporosis, and another 44 million have low bone mass, putting them at risk for the disease. In India, the rising aging population is contributing to an increase in osteoporosis cases, often underdiagnosed and untreated due to a lack of awareness. Osteoporosis does not discriminate by geography, and as life expectancy rises globally, the number of people affected will only increase. Now, osteoporosis does not just usually affect your bones, it can severely impact your quality of life. The most debilitating consequence of osteoporosis is fractures. Hip fractures, in particular, can be life altering. Many people who experience a hip fracture will require long term care, and some may never regain full mobility, leading to a loss of independence. Beyond the physical limitations, there's a significant psychological impact as well. There's a fear of falling or fracturing a bone, and it can result in anxiety and a reluctance to engage in daily activities or exercise, further weakening bones and increasing the risk of fractures, and this create a vicious cycle. Depression is also very common, as individuals may experience a loss of self-esteem and face limitations in social and recreational activities. This particular sense of isolation, it can make managing osteoporosis even more challenging. It is not just a disease of the bones, it affects mental health and social well-being in profound ways. To understand osteoporosis more deeply, we need to dive into how it actually happens, the biological mechanisms behind how bones are maintained, and what goes wrong in osteoporosis. Now, let's start with one of the most fundamental processes in our bones, which is known as bone remodeling. Is a dynamic tissue. It constantly undergoes a process of remodeling, where old bone is broken down and new bone is formed. This balance between breakdown and formation is essential for maintaining healthy bones throughout life. Bone structure is super dynamic. For example, a good chunk of the human population these days, all right, who are using their mobile phones, they have developed a notch on their little finger. Like, look closely and you might be able to spot the difference. मेरी जो ये वाली finger है, मेरी जो ये वाली right hand side, right hand की finger है, that has a notch in comparison to my left hand. यहाँ पे देखा जाए तो right में एक हल्का सा dip ज़्यादा है versus left finger में. Like, तो this is because of how, like, we use our mobile phones. Like, वो ऐसे करके हम लोग use करते हैं. They're always resting on our little finger. And this is a prime example of how your bones are dynamic. Although not all changes in the small finger will be bony in origin, but it can serve as an example. Now we need to talk about how this process actually happens. The osteoclasts. Blast are the making cell, clasts are the destroying wale cell. The osteoclasts are the cells responsible for breaking down or resorbing bone. They secrete acids and enzymes that dissolve the bone's mineral matrix, allowing for the removal of old or damaged bone tissue. And the osteoblasts, on the other hand, are the builders. They synthesize new bone matrix by producing collagen, which then becomes mineralized with calcium and phosphate to create strong, healthy bone. In osteoporosis, this delicate balance between osteoclasts and osteoblasts is disrupted. ऑस्टियोक्लास्ट की एक्टिविटी इंक्रीज कर जाती है या फिर ऑस्टियोब्लास्ट की एक्टिविटी कम हो जाती है लीडिंग टू मोर बोन बीइंग रिजॉर्ब्ड दैन रिप्लेस्ड over time this results in reduced bone density and weaker bones. Imagine a construction site where more material is being removed than it is added. The structure becomes fragile and it is more likely to collapse. Now, let's turn to the hormones that regulate bone health. Hormonal balance plays a critical role in maintaining bone density, and any disruption can lead to significant bone loss. In women, estrogen is perhaps the most important hormone when it comes to bone health. It inhibits osteoclasts and promotes osteoblast activity. That's why when estrogen levels drop after menopause, the rate of bone resorption skyrockets. Postmenopausal women can lose up to 20% of their bone mass in the first 5 to 7 years after menopause. While often thought of in relation to men, testosterone also plays a role in maintaining bone density in both sexes. It is converted into estrogen in bone tissue, helping to preserve bone mass. Men with low testosterone levels are at increased risk for osteoporosis. The parathyroid glands produce the parathyroid hormone and it helps regulate calcium levels in the blood. Now, when calcium levels are low, PTH stimulates osteoclasts to break down bone and reverse calcium into the bloodstream. Chronic elevation of PTH can lead to bone loss, which is why conditions like hyperparathyroidism are often associated with osteoporosis. Produced by the thyroid gland, we've got calcitonin. Calcitonin works in opposition to PTH. It inhibits osteoclast activity and promotes calcium deposition in bones, helping to preserve bone density. While its role in day to day regulation is minor, it is important in the broader hormonal picture of bone health. आप इमेजिन करें कि एक साइड पे पीटीएच है और एक साइड पे कैल्सिटोनिन है वो दोनों एक दूसरे के ऑपोजिट एक्ट कर रहे हैं बट एट द वेरी सेम टाइम दे आर हेल्पिंग टू मेंटेन ऑल ऑफ द बैलेंस इन योर बोन्स कैल्सिटोनिन बोन्स के अंदर कैल्शियम की डिपोजिशन बढ़ा रहा है और पीटीएच ब्लड के अंदर कैल्शियम का लेवल बढ़ा रहा है बिकॉज कैल्शियम इज ऑफ कोर्स नीड फॉर अदर एक्टिविटीज एज वेल. Now, ये जो balance maintain हो रहा है in between calcitonin and PTH, this is very important. For many women, the menopausal transition is the tipping point for bone loss. The sharp decline in estrogen levels leads to accelerated bone resorption. In fact, postmenopausal osteoporosis is one of the most common types of osteoporosis. This is why bone density screening and proactive management are so crucial for women in this phase of life. Hormone replacement therapy, HRT, which involves supplementing estrogen, has been shown to reduce the risk of fractures by slowing down bone loss. However, HRT is not without risks, and the decision to use it should be made on an individual basis, taking into account factors like personal health history, the risk of breast cancer or cardiovascular disease. Beyond HRT, other interventions like calcium and vitamin D supplementation, along with weight bearing exercise, can slow down bone loss during and after menopause. Chronic diseases can further complicate bone health, contributing to the development of secondary osteoporosis. Inflammatory diseases like rheumatoid arthritis can lead to bone loss both through inflammation and the medications used to treat them, such as corticosteroids, which promote bone resorption. Both type 1 and type 2 diabetes can increase the risk of osteoporosis. In type 1 diabetes, lower bone mass may be due to an autoimmune component, while in type 2 diabetes, insulin resistance and the associated metabolic disturbances contribute to bone fragility. People with chronic kidney disease often develop a condition known as renal osteodystrophy, where impaired kidney function leads to abnormal calcium and phosphorus metabolism, weakening bones and increasing the risk of fracture. Lifestyle and environmental factors play a significant role in bone health. Genetics also influence osteoporosis risk. Studies have shown that up to 80% of bone density is determined by genetics. Variations in genes that regulate bone formation, such as those affecting vitamin D metabolism or collagen production, can predispose individuals to lower bone density and higher fracture risk. For instance, individuals with a family history of osteoporosis are more likely to develop the condition themselves. Understanding this genetic predisposition allows for earlier interventions, such as more frequent bone density monitoring and targeted lifestyle modifications. Now, when it comes to osteoporosis, one of the most dangerous aspects is its often silent onset. It is often called a silent disease because many people do not realize they have it until a fracture occurs. By then, significant bone loss has likely already taken place. So, how do we spot osteoporosis before it leads to a break? What signs and diagnostic tools can help us catch it early? Let's talk about that now. Unfortunately, osteoporosis can progress without any obvious symptoms in its early stages. That is why it often goes undetected. However, there are a few subtle signs that can be red flags. Back pain, particularly in the lower region, is sometimes the first sign. This can occur due to tiny fractures in the spine called vertebral compression fractures, which may occur without major trauma. Loss of height over time can be another indicator, often resulting from those same spinal compression fractures. If someone has lost an inch or more in height, it's a good idea to get checked. Stooped posture or a humped back, known as kyphosis, can develop as the vertebrae collapse under the weight of the body, altering the shape of the spine. In some cases, fragile nails and brittle bones may also give an early clue that the body is losing bone mass at a faster rate. However, because these symptoms are often vague, especially in the early stages, many people won't seek medical attention until they experience a fracture. When osteoporosis advances, fractures are the most common and debilitating consequence. Vertebral fractures can happen even without a fall, simply from activities like bending or lifting something heavy. These fractures can cause severe pain, loss of height, and long term spinal deformities. Over time, multiple spinal fractures can lead to chronic back pain and reduced mobility. Then, hip fractures, they are perhaps the most serious and life altering type of fracture. It typically requires surgery and can significantly reduce an individual's ability to live independently. Many who suffer hip fractures face extended rehab and, in severe cases, never fully recover their previous level of mobility. It is also associated with higher mortality rates due to complications. Wrist fractures, particularly fractures of the radius bone, are common in people with osteoporosis. They often happen when someone extends their arm to break a fall. अगर आप गिर रहे हैं आपने अपना हाथ ऐसे एक्सटेंड कर दिया और राइट या ऐसे अगर आप कर रहे हैं गिरने के टाइम पर तो आपका रेडियस पे इम्पैक्ट आता है. Now, while wrist fractures may seem less severe than spine or hip fractures, they can limit a person's ability to perform daily tasks and indicate an increased risk of future fractures. Recognizing these common fracture sites helps to underline the importance of an early intervention. Once a person has experienced a fracture, the risk of subsequent fractures dramatically increases. So, how do we accurately diagnose osteoporosis before these fractures occur? One of the key tools used is bone mineral density testing or BMD testing. The gold standard for this is a dual energy X ray absorptiometry, or in shorter words, a DEXA scan. A DEXA scan measures bone density in areas most prone to fractures, typically the spine, hips, and wrists. It works by passing low levels of X rays through the body with two different energy peaks, one absorbed by soft tissue and the other by bone. The difference between these two peaks gives a precise measure of bone density. The results of a DEXA scan are given as a T score. A T score of -1 or above is considered normal bone density. A T score of -1 and -2.5 indicate osteopenia, which is a precursor to osteoporosis. And a T score of -2.5 or lower, it confirms osteoporosis. The scan is non invasive, quick, and painless, lasting around 10 to 15 minutes. It is typically recommended for women over the age of 65 and men over 70 or earlier for those with additional risk factors. While DEXA scans are the primary method for diagnosing osteoporosis, other imaging techniques can be useful for assessing the severity of the condition or detecting fractures. X rays are often used to visualize fractures after they occur, especially in the spine, hips, or wrist. However, X rays only detect significant bone loss. Usually, more than 30% of bone mass has already been lost, making them less sensitive for early detection. We've got MRIs and CTs then. They are occasionally used in more complex cases. MRI is particularly useful for detecting vertebral fractures that may not be visible on X rays, while CT scans provide more detailed images of bone structure and can be helpful in surgical planning for fractures. While these advanced imaging techniques provide valuable insights, they're typically reserved for more complex or uncertain cases. Prevention, as they say, is better than cure. When it comes to osteoporosis, preventive strategies can make a world of difference, both for keeping bones healthy and for minimizing the risk of fractures later in life. So, what can we do to give our bones the best shot at staying strong as we age? Now, let's start with calcium and vitamin D, the two most crucial nutrients for bone health. Calcium is the mineral that forms the structural foundation of your bones, while vitamin D ensures your body can absorb calcium efficiently. For adults, the daily intake of calcium is around 1000 to 1200 milligrams, depending on age and gender, but getting this amount isn't just about supplements. In fact, a diet rich in calcium filled foods is one of the best ways to meet these recommendations. Dairy products like milk, cheese, yogurt are well known calcium sources. For those who are lactose intolerant or prefer plant based options, plant milks, tofu, leafy green vegetables like kale and spinach, and nuts like almonds can also provide ample calcium. Now, while calcium is crucial, it cannot do its job without enough vitamin D. Vitamin D helps increase the absorption of calcium from the gut into the bloodstream. Most experts recommend about 600 to 800 IU of vitamin D, IU या फिर international units of vitamin D on a daily basis, though certain groups may need more. Food sources of vitamin D include fatty fish like salmon, egg yolks, and fortified cereals. But there's another vital and often overlooked way to boost your vitamin D levels, which is sun exposure. Sunlight plays a significant role in the body's ability to produce its own vitamin D. When UVB rays hit the skin, they trigger the production of vitamin D3, which is the most active form of the vitamin. In just 15 to 30 minutes of sun exposure, depending on skin type and location, the body can generate enough vitamin D to meet its daily needs. However, as we age, our skin becomes less efficient at synthesizing vitamin D. Additionally, sunscreen use, while vital for protecting against skin cancer, can reduce vitamin D production. That's why it is important to balance safe sun exposure with dietary sources and supplementation when necessary. So, if you can, try to get outside for a bit of sun each day. If you live in a climate with limited sunshine or spend a lot of your times indoors, talk to your healthcare provider about whether vitamin D supplements might be a good option for you.